Now, this raises a lot of questions, though, about COVID. We haven't talked about COVID in a while in the program. New study done in Japan found out face masks become disgusting bacteria traps as mandates continue. And they evaluated 3 types of face masks that are commercially available in Japan: non-woven, polyurethane, gauze, or cloth masks. And they captured cultured bacteria and fungi from both sides of the mask worn by 109 medical school volunteers. 99% of the samples had bacterial colonies growing inside the mask. 94% had it on the outside. Fungi, 79% of the samples had it on the inside, 95% on the outside. And as far as duration, study found there's a correlation between an increased risk of fungi growth and the longer you wore the mask. Now, the conclusion by these Japanese researchers is as follows. Immunocompromised people should avoid repeat use of masks to prevent microbial infection. In other words, if you are compromised, you're not supposed to use your mask more than once. People use their mask all the time. And based on these findings, there is zero evidence the mask worked against even less contagious variants. Zero evidence. Now, there's a study out here in LA County that the CDC relied on for the school mask mandates. Turns out it was authored by the LA County Public Health Director's daughter, who is also not an MD. The study found that the COVID mitigation efforts, including forced masking, were highly effective in stopping the disease spread. Cited by CDC, cited by a whole bunch of news outlets. Turns out that the woman who helped to author the study is not a medical doctor, doesn't have a science background, doesn't have a PhD in any field. Her professional background is a combination of urban planning and community organizing, and she co-authored the study. Was hired by the LA County Office of Education in late 2020 as a temporary project manager and PR and communications department. Also did a few political campaigns for her mom and for the Boston mayor, Thomas Menino. She is well qualified. She's probably as well qualified for that job as Mayor Pete is for the job as Secretary of Transportation. But I digress. Another study. Do mask mandates work? We talked about this a few days ago. Turns out that because of an uptick in COVID-19 cases, Alameda County was the only Bay Area county to bring back the mask mandate indoors. At the time, the county health officer, Dr. Nicholas Moss, said, quote, "Putting our masks back on gives us the best opportunity to limit the impact of a prolonged wave on our communities." Now, since that was the only county in the Bay Area that brought back the mask mandate, they gave us an ideal laboratory to find out whether or not there's going to be any difference in infection rates when you compare them to the adjacent counties, Contra Costa and Santa Clara. And it turns out no difference in infection rates, none, which suggests that the mask mandates, despite the study that was co-authored by the daughter of the health county official, daughter not an MD, despite that study, it turns out the mask mandates didn't work. One of the reasons is that people don't wear them properly. They don't use N95 because it's so uncomfortable. The cloth masks and the gauze masks don't do anything at all. So it turns out the mask mandates are not effective, at least according to this Bay Area study. They gave you an ideal case. Again, one county, Alameda, brought it back. Counties on either side did not. No difference in infection rates. This ought to be disturbing. Health experts are quitting the CDC and the NIH due to, quote, bad science, according to Dr. Marty McCary. He's a professor at Johns Hopkins. And Johns Hopkins is still accredited as far as I know. He says that low morale fostered by bad science and frustrated experts causing people at the NIH, the National Institutes of Health, and the CDC and the FDA to quit, creating serious staffing shortages. The leadership of the agencies is being questioned. The Pfizer trial data found no really big difference that the shots provided for young children, yet they approved them anyway. A lot of people did not think that was good and have resigned. FDA vaccine panels have expressed concern about the lack of safety data for the children. Dr. McCary, writing for the Substack page called Common Sense, so you don't get canceled on the social media platforms, said other decisions by the NIH, by the CDC, by the FDA have hurt morale among employees, including support for the masking mandates in schools and the closing of the schools during the pandemic. One FDA official said this, and I'm quoting, "It's like a horror movie I'm being forced to watch, and I can't close my eyes. People are getting bad advice, and we can't say anything." One NIH scientist spoke on the condition of anonymity, said, quote, "There is no leadership right now. Suddenly, there's an enormous number of jobs opening up at the highest level positions," end of quote. A CDC scientist told Common Sense, also on the condition of anonymity, I wonder why nobody wants to give his or her name, that the agency, quote, "failed to balance the risk of COVID with other risks that come from closing schools. Learning loss, mental health exacerbations were obvious early on, and those worsened as the guidance insisted on keeping schools virtual. CDC guidance worsened racial equity for generations to come. It failed this generation of children," end of quote. What they mean is that black and brown students were already behind. Now they're behind another year or two. I mentioned I think it was yesterday, 85% of black 8th graders are neither math nor reading proficient. 85%. And the majority of them, almost all of them, are in government schools, and these are the ones that were shut down. So they're already behind, and now behind even more. And Dr. McCrory gave an interview to Fox News' Tucker Carlson, and he says the doctors working at the federal agents are muzzled, his word, not mine, prevented from presenting their views on various issues if they conflict with the government's narrative. Quote, "I talked to many doctors," he said, for this piece, at NIH and CDC, and they are extremely frustrated, end of quote. I hope Dr. McCrory has tenure at Johns Hopkins. He says, quote, "They are smart people who know that the various vaccines provide no benefit and there is no health emergency among young children," end of quote. McCrory said, "Not only are the agencies bypassing the normal scientific process, but the scientists can't really say anything because if they do, they know their jobs are at risk and they will be treated differently," end of quote. One scientist told McCrory there is no transparency in how the top White House advisor, Dr. Fauci, makes decisions. Fauci, by the way, has announced he's not going to retire, although he said he's going to retire. He's not going to retire. Now, I read the New York Times every morning, so you don't have to, and I get an alert. Big headline, "Guide to BA.5, the latest coronavirus strain." And talked about how this one is the most contagious of all. But then it says that there are a lot of people that are rejecting this. LA County Chief Medical Officer rejects COVID-19 media hype. What? His name is Dr. Spellberg, Brad Spellberg. "Our COVID situation is just the same. Hasn't changed." But I just read you an alarmist headline from the New York Times. "We're seeing thousands of people with COVID, but it is mild and they go home." He said the patients who are admitted to the hospital, 90% of the time, it's not due to COVID. Only 10% of our COVID positive admissions are due to COVID. None of them go to ICU. When they do, it's not for pneumonia. They are not intubated. We have not seen one of those since February. But look at all these headlines. He said a lot of people have really bad colds that we're seeing. It's just not the same pandemic that it once was, despite all the media hype to the contrary, he says. I mean, a lot of people have bad colds. That's what we're seeing. So many people are testing at home and are not reporting in. So that's another one. So we have no idea really how many people are testing positive, but the fact that they're not coming in suggests that maybe, just maybe, this variant is not all that big a deal. Still, you have all these screaming headlines, including from CNN. National Review says that cases are rising, but the average daily death rate is not rising. And it mentioned that CNN had this big headline, "The worst variant is here." And it spurred Nate Silver, who is a stat guy, used to be with the New York Times, to say that the headline is, quote, "badly misleading." The variant CNN referring to is the one the New York Times referred to, BA.5. And the CNN article also said this, quote, "The variant does not appear to lead to more severe illness." The variant does not appear to lead to more severe illness, end of quote. So, bottom line is, people are getting sick because of this variant. The variant apparently is giving people mild symptoms. If you are in a so-called high-risk category over the age of 65, you've been double boosted, like Joe Biden has, you have very little risk of contracting anything. And if you are a young person, very little risk of contracting anything, of getting sick, of going to the hospital, and certainly very little risk of dying. When we come back, why hasn't Steve Colbert's team been arrested for a January 6th style attack on the Capitol building? Don't go away. Hope you enjoyed that video. The full show is available to watch right now on Epoch TV. Just click the link in the description below to learn more, because we've got a country to save.